Hello friends, welcome to this online learning platform. So we will be studying about the basics of pharmacokinetics. I, Dr. Rahul Adnaik from Anandi Pharmacy College, welcome you all to this online learning platform. So the learning objectives of this session are: after attending this lecture, the students will be able to define and explain various pharmacokinetic processes, describe processes of drug absorption and factors affecting absorption. So here is the schematic presentation of various pharmacokinetic processes. So as we all know that pharmacokinetics means what does body does to the drug. In other words, it deals with what body does to the drug. Kinetics means movement and pharmacon means drug. It means that what body does to the body, what drug does to the body, wherein the drugs are moved from one place to another. So these processes include absorption, distribution, metabolism and excretion. Together they makes up ADME parameters: absorption A, distribution D, metabolism M and excretion E. So these makes up the ADME, that is the basic pharmacokinetic processes. Let's begin with the first pharmacokinetic parameter, that is absorption. So absorption, it is nothing but it is the movement of drug from its site of administration into the systemic circulation. That means when the drug is administered from its site of administration, it enters into the systemic circulation, that is the blood. So this process is called as the absorption. It is the process by which drug enters the circulation from its site of administration. It is essential for the drug to reach the circulation so that it is distributed in the body. Both the fraction of drug absorbed and the rate of absorption, these two parameters are very important: fraction of drug absorbed and the rate of absorption. So during the process of absorption, the drug has to cross various barriers, of which the most important one is the cell membrane barrier. Another point to be remembered is that absorption is required except the drugs which are given intravenously, which enters the blood directly. The knowledge of absorption is essential to determine dose and frequency of administration. Dose, that is what concentration or what dose is to be given, and frequency means in for how many times the drug is to be given. The extent to which the drug is absorbed in the blood from the site of administration depends upon its ability to cross the membrane. So this is untypical biological membrane. So as we all know that the cell membrane consists of lipoprotein bilayer. So these lipoproteins, they are arranged in two parallel rows having polar head, which is hydrophilic in nature, and non-polar tails, which are hydrophobic in nature. Next is the various processes of drug absorption. So the drug is absorbed by two basic mechanisms. One is called as the passive process and second is specialized transport. Passive process, wherein there is no active involvement of cell membrane and it does not requires energy. Specialized transport, also called as the carrier mediated transport, and it requires energy. Passive process divided into passive diffusion and filtration. Specialized transport divided into active transport, facilitated diffusion and pinocytosis. Let's begin with the passive process. Before that, some important points are to be remembered, that is small drug molecules, they are absorbed by the process of filtration. Large size molecules, they are absorbed by diffusion. Certain large lipid insoluble drugs, they are absorbed by active transport process. So let's begin with the passive processes, including passive diffusion, which is nothing but herein the drug diffuses across the membrane in the direction of its concentration gradient, that is from higher to lower concentration, and here membrane plays no active role in this process. In this process, lipid soluble drugs diffuse across the membrane by dissolving in lipoidal matrix, and the rate of transport is proportional to lipid water partition coefficient. That means more the lipid water partition coefficient, more will be the absorption. Next process is filtration, wherein the drug passes through the pores in the cell membrane, and only water and water soluble drugs having molecular size less than the diameter of the pore size can be transported by this process. So this is a diagrammatic representation: higher concentration on one side of the membrane and lower concentration of drug on another side of the membrane. In passive diffusion, drugs are transported from higher to lower concentration by dissolving in the lipoidal matrix. In filtration, drugs passes through the pores in the membrane. So this is all about passive diffusion and filtration. Next processes are specialized transport processes, wherein the first is active transport process, where the drugs are transported against the concentration gradient, from lower to higher concentration, which requires energy. A carrier molecules combines with the drug molecule, forming a complex, and this complex diffuses through the membrane. On other side of the membrane, it gets dissociated into carrier and drug molecule. That's why it is called as carrier mediated transport. Examples are vitamin B12, levodopa and methyl-dopa. Next is facilitated diffusion. It is very much similar to active transport, only difference is that it does not require energy. Example is glucose transport into RBC. Another important process of absorption is pinocytosis. So as we all know that phagocytosis means cell eating. So in similar way, pinocytosis means cell drinking, wherein the drugs are transported across the cell membrane in particular form by the formation of vesicles, that is in liquid droplets. Herein protein and macromolecules are absorbed by this process. So this is all about the various processes of drug absorption divided into passive diffusion and specialized transport mechanisms. So here is the diagrammatic representation of facilitated diffusion and primary active transport. Both these are carrier mediated transports, wherein the drug gets attached to the carrier and then transported to the another side of the membrane. Only difference is that in facilitated diffusion there is no involvement of energy. In active transport there is involvement of energy, that is ATP is converted into ADP. So this is all about the various processes of drug absorption. Now the next point that we are going to discuss is about the various factors that affect the rate of absorption. So these factors are enlisted here, including route of drug administration, physicochemical properties of drug, biological factors, local pH, state of drug, concentration, area of absorbing surface, rate of blood flow, pharmaceutics factors, first pass effect and other factors. Let's begin with the route of administration. So we'll discuss route of administration as a factor affecting, considering three important routes: oral route, parenteral, subcutaneous and intramuscular, and topical route. So in case of oral route, so we all know that when the drugs are administered by oral route, so drugs are absorbed from two important parts of GIT, that is one from small intestine and second from stomach. So the drugs which are administered by oral route, so their absorption from upper small intestine is more because of more surface area. The drugs which are not absorbed by oral route, they cannot be given by oral route and they are to be given by injection. So there can be three different kinds of drugs: acidic drug, basic drugs and neutral drugs. Acidic drugs, they remain unionized in gastric juice and they are better absorbed from stomach. Basic drugs, they are largely ionized in stomach and unionized in intestine, and that's why they are absorbed from intestine where pH is basic. Non-ionized drugs, so they are equally absorbed both from stomach as well as intestine. That means acidic drugs are better absorbed from stomach, basic drugs better absorbed from intestine, and non-ionized drugs equally absorbed from stomach as well as intestine. The presence of food may dilute and affect the absorption process. There are certain drugs which forms a poorly absorbable complex with the food constituent. A very classical example is of tetracycline with the milk, which forms a poorly absorbable complex. Certain drugs which are degraded in gastrointestinal tract cannot be given. Common classical example is insulin. Why insulin is not given by oral route? Because it is degraded by the peptidase enzymes. So another route is subcutaneous and intramuscular. So both these are very important routes because the drugs are better absorbed on intramuscular and subcutaneous injection. When the drugs given by injecting they are deposited near the capillaries, and capillaries being highly porous, it does not obstruct the absorption. Large molecules are not absorbed through lymphatics. There are many drugs which are absorbed orally and which are not absorbed orally, and they can be given by injection route. Absorption from subcutaneous is slower than intramuscular, but both these are more consistent and predictable and faster than oral absorption. Next important route is topical route, wherein depends upon the lipid solubility of the drug. Only few drugs penetrate the intact skin. Examples are nitroglycerin. Absorption can be promoted by rubbing the drug on skin. So this is the basic principle why when we apply any topical drug, we rub the site. Some lipophilic drugs are well absorbed from mucous membrane of mouth, rectum, vagina and abraded surface. So this is the way by which various route of administration affects the drug absorption. So next factor is physicochemical properties. So we all know that there are very different kinds of physicochemical properties, including size, shape, lipid solubility. So in case of size, smaller the particle size, better will be the absorption. Size and shape, crystalline drugs are better absorbed than amorphous form of the drug. More the lipid solubility, better will be the absorption. So in this way, physicochemical properties affects the absorption process. Biological factors. So in this, the presence of various enzymes, various hormones, various other biological barriers, they affects the process of absorption. In case of pH, so as we all know that already discussed, acidic drugs better absorbed from stomach, basic drug from better absorbed from intestine, and neutral drugs are absorbed equally from stomach as well as intestine. That means pH affects the process of absorption. State of drug, so drug can be in solid, liquid or gaseous form. The drugs which are in liquid form, they are better absorbed. In case of concentration, more the concentration of drug, more will be the absorption. Area of absorbing surface, so as we all know that greater the surface area, better will be the absorption. In case of rate of blood flow, since the drug after absorption comes in the systemic circulation, more the blood flow, better will be the absorption. So pharmaceutic factors, it includes the various formulation aspects. That means excipients which are present in the formulation, they affect the process of absorption. For example, in case of tablets, various excipients are used, including binder, disintegrating agents. So different excipients will affect the process of absorption. First pass effect, it is another important factor, wherein when the drug comes into the human body, before absorption it enters the liver, from where it gets degraded, and only small fraction of drug enters into the blood. That means this is called as first pass effect. So this first pass effect decreases the amount of drug available for absorption. In simple words, first pass effect decreases the absorption of drug. Other factors, here you may consider the factor of presence of disease condition. If there are diseases related to gastrointestinal tract, definitely it will affect the oral route of drug administration and the drug which are absorbed from oral route. So these are various factors which affects the absorption of drug from its site of administration. So in this way, we have discussed about the basic definition of absorption, various processes of absorption including passive process and specialized transport, and lastly the various factors that affect the rate of absorption. So once again, thank you